A very warm welcome to all of you to this video lecture. So today we'll try to understand what the clinical pharmacokinetics is. So let's start. This is the from the introduction. Let's uh, let's assume when a patient visit to the doctor, according to their patient's problem, they recommend the therapy or they prescribe few drugs to them according to the therapy and according to their regime for the treatment. So what happens when a doctor give a therapy? He may have the following problems. He may have the different kind of patient conditions, as you can say in the yellow box. So he may have, the patient can show a lack of therapeutic response, means the therapeutic failure, you can say, or the patient is not responding to the drugs what the doctor have prescribed already. So next point is the patient may show the toxic effects also. The third one is the patient may show the non-compliance to the medicines or to the prescription. So and sometimes there may be variability in the relationship of dose and the concentration. And lastly we can say sometime therapeutic or toxic action not easily, you can say, quantified by the doctor with that therapy. And sometime to the last point what I'm explaining to you, the dosing in obese and pediatric and the elderly patients, sometime doctor face few kinds of problem also, because these are the special category of the patient. So then collectively all the healthcare professional teams, or you can say clinical pharmacist, by using the you can say application, or by applying the principle of pharmacokinetics, they can go for therapeutic drug monitoring and the individualization of dosage regime. By using a TDM and individualized dosage regime, with the help of these pharmacokinetic principle, the clinical pharmacist can optimize the therapy and can increase the benefits of, you can say, patient by increasing the safety of a therapy, by decreasing the side effects, by reducing the cost, and in such a way the clinical pharmacist can optimize for the maximum benefit of a patient. So ultimately this is possible by application of clinical pharmacokinetics. So today what we are trying to understand is the clinical pharmacokinetics. As you can see on the screen, what is the clinical pharmacokinetics? Got it? Clinical pharmacokinetics is basically, as I have told you, if we consider simple pharmacokinetics, is the study of time course of the drugs movement through the body, that is ADME. In a pharmacokinetics, basically pharmacokinetics is the understanding of ADME. Got it? Or we can say what the body do with the drug. Got it? So body absorb, body will distribute, metabolize and excrete the drugs. By getting these principles, by getting various pharmacokinetic parameters of a drug, these principle can be applied to get maximum benefit for the patient, to get you can say we can use therapeutic drug monitoring and individualized drug therapy to get you can say maximum benefit from the therapy, or we can reduce the side effect, or we can reduce the cost of the therapy also. So in many of the ways we can improve that therapy for a patient. So this is all about the clinical pharmacokinetics. When we apply these principles to the clinical situations, this is called as clinical pharmacokinetics. So now we are coming to pharmacokinetics and the pharmacodynamics. All, I think all of you are very familiar with it. In your previous classes you have already gone through this. So pharmacokinetics, we are going through it. Pharmacokinetics means what the body do with the drug. Got it? As we have mentioned earlier, the body, what the body do when you take a medicine inside your stomach, body will absorb it, body will distribute through the blood circulation throughout the body, throughout the organs and tissues of the body. So tissue will your organs will also, your body will also metabolize. For example, liver will metabolize the drug which you take. Next is the excretion. Finally, drug will be excreted by your different organs like kidney, lungs and all other organs. So we are coming to pharmacodynamics now. When actually in the simple words we can say the what the drug do with the body. Just reverse to the pharmacokinetics. So here the drug concentration at the site of action or the plasma is related to the magnitude or the effect. When the drug reaches to the site of action, it by any of the mechanism, by different mechanism, they bind to the receptor and they execute that mechanism and will definitely get to the therapeutic effect, what we want from the drug, what kind of treatment we want. So ultimately the drug will give us the respond if we supervise the therapy in a better way. So this is all about pharmacodynamics. So now we are coming, this is the diagrammatic representation of pharmacodynamic and pharmacokinetics. So in pharmacokinetics, as you can see, when drug reaches to the body, inside when we administer the drug into the body, body will absorb, distribute, metabolize and eliminate. So this is reflected in the red, that when it reaches to body will absorb, distribute, metabolize and eliminate. So further, when it reaches to site of action, it will show its therapeutic effect. So this is the pharmacodynamics. So now we are coming to pharmacokinetic parameters. So to better understanding of the clinical pharmacokinetics or to optimize any of the therapy, so we must know the various pharmacokinetic parameters so that we can apply to calculate the dose and the frequencies, so that we can design a better dosage regime, or we can individualize the therapy for a particular patient or a particular category of the patient. So these are the few pharmacokinetic parameters. As you can see, this is the Cmax, Tmax, half-life, and AUC, area under the curve, clearance, CL is the clearance, VD is the volume of distribution, K stands for the elimination rate constant. In the graphical representation or the diagram, you can see the plasma concentration is on the y-axis and the time is on the x-axis. So you can see the area which is under the curve is called as AUC, which is represented as a little you can say purple color. So it represents the bioavailability of the drug, basically how much it get absorbed. So next you can see after the absorption, you can see at the top Cmax. Cmax is the maximum concentration of the drug that is achieved after that dose which we have administered into the plasma. Got it? So this is the maximum concentration that can be achieved in the plasma after taking oral dose, or you can say any kind of administration. So now we have a Tmax. Tmax is the time at which maximum concentration is achieved. Got it? So this is Tmax. Half-life is the, you can say with these blue arrows, the distance at the time axis, you can see the two lines are aparted by the one blue line, that is the half-life. When the drug amount remains half of the what the dose have taken to. Got it? So next is the AUC, as I have told you. Now we'll discuss in detail the few, that is the volume of distribution, which is represented by VD. Actually volume of distribution is the apparent volume of distribution, which is basically a theoretical volume. Got it? It may not be real, because I'll explain you next in next few slides. So it is a theoretical volume that would have to be available for the drug to disperse in, if the concentration everywhere in the body were the same as that in the plasma or a serum. The place where the drug concentration sampling generally occur. For example, when you take a drug through the oral route and the concentration and the amount reaches to systemic circulation. So now we are talking about volume of distribution. So it means that how much drug, or you can say drug, get distributed to how much volume of a liquid which is present inside your body. So this is the how much volume in which drug get dispersed actually. So it is represented by Vd, and it gives the information how the drug is distributed in the body. It may vary from person to person, it may vary with the weight also. So it can the most important part of about this pharmacokinetic parameter is the volume of distribution is used to calculate the loading dose. Clear? So let's see. Next is that this is, you can this is the kind of diagrammatic representation. If this red box is represented by a single compartment of the body, so here it is represented that the drug is in the form of red, that it is dispersed uniformly, and the volume of distribution for this particular drug is 100 liters. So now let's talk about volume of distribution, how you can calculate if we know the dose and the plasma concentration of the drug at a particular time or after a particular time. So we can also estimate the volume of distribution by dividing the dose with plasma drug concentration. So this is all about the calculation of volume of distribution. So now we are coming to the next pharmacokinetic parameter, that is the clearance. How we can get the idea of a clearance. Clearance is the ability of organ to eliminate the drug from the bloodstream. Got it? So clearance is the you can say ability of the organ like liver, like kidney. So how effectively they clear the blood from they clear the drug from the blood. Got it? So next is the volume of the fluid which is completely cleared of a drug per unit time. Actually clearance is the volume basically. If we look at the units also, unit represent is the liter per hour. The unit of this clearance is liter per hour. So liter means a volume. So clearance basically is a volume of the blood from which the drug is cleared off in a given period of time. So here the unit is liter per hour. So we can say also say the liter per hour per kg if we are talking about the weight also of the patient. So now we are coming to one of the more important aspect of the clearance. The clearance, this kind of pharmacokinetic parameters is used to determination of maintenance dose. So we are coming to the loading and maintenance dose and their calculation also. So let's see. Now we are here with the clearance formula. The clearance unit, as you can say, the best we can say clearance is equal to volume of blood cleared from the drug per unit time. This is the shortest we can write. The clearance definition is volume of blood cleared of drug per unit time. Got it? So just now here we are having the calculation of key, because if we know the volume of distribution and if we know the value of clearance, if we know these two values, so we can calculate the elimination rate constant. This is the another, you can say, pharmacokinetic parameter. So with the help of clearance and volume of distribution, we can also calculate the elimination rate constant value. So how we can calculate, and let's first understand what is the elimination rate constant. Elimination rate constant is represented by K, and which is a fraction of drug in the body which is removed per unit time. Now let's differentiate between clearance and the K. Basically K, let me explain you here. K is basically a speed of elimination of drug. K is the rate means the speed, and speed at which the drug is eliminated. So now here is the here what we are related with, drug and the speed, amount and the speed of the drug, of the, you can say, drug which is get eliminated. So clearance is equal to KEV, and if in terms in books you can say clearance is equal to KEVD. So Ke basically represent as a elimination rate constant multiplied by volume of distribution gives you the clearance. So here by this formula, by this relationship, by this equation, we can calculate elimination rate constant. So in the last slide I have told you the values of clearance and you can say volume of distribution. So by putting these values, we will ultimately get the value of K, that is elimination rate constant. Got it. So now this relationship again I am trying to explain you that at a clearance, because it is a constant at a time for a drug for the body. If the clearance is constant, you can, if you increase the volume of distribution, then the elimination rate constant, it will going to be decrease, so that equation can be balanced. So now in the last few slides we have gone through the main important concept which is written below. So one by one let them recall. The volume of distribution is theoretical volume and determine the loading dose. So volume of distribution is a very important pharmacokinetic parameters that we have to understand to calculate the loading dose. And loading dose calculation itself, it is a part of clinical pharmacokinetics, as we have gone through the first few slides. As we have seen there, we have, when we are dealing with the patient, then we have to calculate loading dose, maintenance dose, and their frequency also, to get them maximum clinical benefits and to reduce their side effects. So now we are coming to the next point, that is clearance is a constant and determines the maintenance dose. So here from the first 2 points it is clear, if we want to calculate the loading dose, we need volume of distribution. So if we need to calculation of maintenance dose, we need clearance. So these two pharmacokinetics is required. So that is why we have gone through these pharmacokinetic parameters. So now we are coming to the third relationship, that is clearance is equal to KEVD. K stands for elimination rate constant and VD is the volume of distribution here. And let me tell you, clearance and the volume of distribution is independent variables, and in this relationship K is the dependent variable. So now, as I have told you that we have also gone through that loading dose. Here is the equation, or here is the formula to calculate a loading dose, and here we can see clearly we need volume of distribution, as we have learned in previous slides that what is the volume of distribution and what is the importance. So importance was this volume of distribution is used to calculate loading dose. Loading dose is the initial dose, it is given in the initial when the treatment begins, when the therapy begins, and to achieve that minimum effective concentration in the blood. So it is always higher than the loading dose, because it is required from 0 to maintain that particular minimum effective concentration or that steady state concentration in the blood plasma. So it is always greater than maintenance dose, and it is always given before the maintenance dose and in the beginning of the therapy. So how we can calculate the loading dose? So loading dose is equal to Cp, that is targeted. Cp here stands for plasma concentration, plasma drug concentration, that is targeted. Targeted means that concentration, that steady state concentration that is desired or that is to be maintained in that particular therapeutic index to get the safer therapy and the better therapy or better responses from that drug into volume of distribution of the body or the drug. So now we are coming to the question. Now we are having the problem. This is one of the problem. Let's solve it. I'll tell you one question. Please write it down and try to solve it. So this is the, what is the loading dose required? Here what I am asking here is, what the examiner is asking is the loading dose. How much loading dose is required for a drug A if these following thing is already given. What is given here? The targeted concentration. Targeted concentration means the plasma drug concentration that is required to be maintained, that is 100 mg per liter, and that is 10 mg per liter, sorry, So next is volume of distribution. Here is 0.75 liters per kg. Please keep in your mind here the units are liter per kg and the volume of distribution is given in liters per kg. So next is the patient weight is 75 kg. So please keep in mind during the calculation, volume of distribution is this much for 1 kg and the total weight of the patient is 75 kg. So we have to calculate according to that formula and this particular weight of the patient. So answer, try to solve it, and this is the solution. As we know that this is the particular formula, that dose is equal to target concentration and the volume of distribution, where the volume of distribution, as I have told you, it is given per kg and we have to multiply it with the total weight, which will ultimately give you the total volume of distribution, that is 56 liter 0.25 liters, and the targeted concentration is 10 mg per liter. Dose is, so how we can calculate the dose, 10 multiplied by total volume of distribution, that is 56.25, which will give you the answer, that is the loading dose will be 565 mg. So approximately near to that you can administer, that is 500 mg we can administer to that patient. So now we are coming to maintenance dose. Maintenance dose is the dose which is given after the loading dose to only for the maintenance of that particular concentration which we have already achieved after the administration of loading dose. So maintenance dose is always lower than the loading dose. So how we can calculate? Let's see. Maintenance dose is equal to clearance. That is why we have already gone through this particular pharmacokinetic parameter, clearance, multiplied by plasma concentration, that is average of steady state, or we can say steady plasma state plasma concentration of the drug, or you can say the average of that particular fluctuation. Now let's try to understand what basically a steady state is. A steady state is the what a target average steady state drug concentration that have to be maintained in the therapeutic index to get the safe therapy or effective therapy. So this state can be achieved when the rate of input is equal to rate of output of the drug in the body. So next is the it reaches when you start administering the dose, and after the 4 to 5 half lives, if the kinetics, if we consider it is a linear, so if drug is acting as a you can say first order, you can say kinetics, following the first order kinetics, then after 4 to 5 half life of that particular drug, that steady state concentration will be achieved generally. So now we are coming to the unit of clearance. Unit of clearance is liter per hour, and the maintenance dose unit will be mg per hour. So it will be multiplied by 24 hour to get the maintenance dose for 24 hour. So now with this you can say graphical representation, we'll try to understand what the you can say steady state plasma concentration is. You can see this red line particular pattern, this is for this you can say concentration is following. As you can see on the y-axis, the concentration is represented here, and on the x-axis time is there. So this actual, when we administer the dose, and the red pattern is observed, these fluctuations will be able to get after the administration of various doses. So here we can see this dotted black line is the average of the all these red line patterns. So ultimately we'll get an average dotted black line, and this black dotted line get parallel to the x-axis after a certain period of time. So that particular period of time is after 4 to 5 half lives, that we can count the lower peaks of this red line. So that the blue arrow is representing after the 5 half lives, So this one valley, peak and valley pattern represent one half-life. Got it? So next we are coming to the uh, question where is the what the how we can calculate the maintenance dose. So maintenance dose can be calculated, or the problem which is based upon you can say how we can solve these problems. So what the problem here is, what maintenance dose is required for a drug A if the concentration same that as we have seen in the previous question, 10 mg per liter we have to achieve with the clearance. Here the clearance is given. Clearance of drug A is 0.015 liters per kg per hour, and the patient weight is again 75 kg, and this is how we can solve it with the formula which we have already gone through. Clearance is into plasma average concentration, and here is the value. So ultimately we get the value or a dose after the simplification is 270 mg. So this is all about introduction of pharmacokinetics. Thank you all of you, and have a nice day. Thank you.